Hello friends, I am Dr. Sunil Saini, trauma surgeon, expert in limb lengthening, deformity correction, pain management, ozone therapy and various nutraceutical therapy including hydrogen therapy. Today we have another patient who is coming from Srinagar to Gurgaon in Pataudi. He is suffering from AVN. He is having both hip avascular necrosis. On right side it was grade 3, on left side it was grade 2. Now in many previous videos I have demonstrated the techniques which we are using to save the hip. We need to save hip, especially of AVN. After COVID, a lot of patients have increased, especially of AVN, and we have seen even the research is now out. The paper has been published on the treatment which are being given by Indian Academy of Orthopedic Surgeon, in which we are giving hip arthrodiastasis with the help of hydrozone plus ozone. Along with that, we are giving basically EBOO or ozone autohemotherapies, and then nutraceutical therapies like hydrogen therapy, antioxidant therapy, and along with that we basically give M regime, that is called Mukherjee regime. So today we are demonstrating how to give EBOO. Now this patient's already, everything has been set up. This is our iOS setup. We are not using any renal filters, so it's basically without our EBOO technique, which is Indian Academy of Orthopedic Surgeon technique. In iOS technique, we are not using any renal filters. This is EBOO without any renal filters. Now many patients have queries, especially who are going for various therapy like cancer therapies or wellness therapies. If you have not filter, then how all the exudates or all the inflammatory things will come out. So there is a waste things. So the waste you can see here, this is the blood which is getting collected. So this is our blood section. Now here is the ozone which is coming, and now here we are collecting the froth which you are seeing is basically the waste, and we have a waste pipe. Slowly all the waste will come out through this. So there is no need of filters here, but definitely the waste is coming out we have a waste pipe also. So this is iOS EBOO system. So this is the donor side from where the blood is coming, and that is the recipient side which we have primed, and you can very well appreciate the difference once we will start the transfusion. So now dear friends, you can see here this is our UVBI chamber, and now we have started the transfusion also. Now you can very well differentiate. This is the blood which is coming from the donor side, and this is the blood which is getting ozonized, and now it is going into the blood. You can very well appreciate the difference. The difference you can very well appreciate. Then there is change in the color. The blood is coming from the donor side. It is getting ozonized in this UVBI chamber. This is the waste pipe. Now waste has started coming out. These are the froth which has started coming out. You can see here. And this is the ozonized blood. You can very well appreciate the difference in the ozonized blood. This is the donor side which is looking very dark, and this is the blood which is after getting ozonized. This blood has a very high capacity of oxygen now, and this will help in various things, include it act as a antioxidant at the cellular level, although it is an oxidant, but act as antioxidant at cellular level, helps in wellness, anti-inflammatory. It will help in immunomodulation, basically immune modulation. All are these things which we have already covered in various videos. What are the benefits of taking ozones, and there are various methods of taking ozone. This is extracorporeal blood oxygenation, ozonization, which is used in various conditions, not only for the disease part but also for the wellness purpose. In fact, in the cancer patients, in various infections like hepatitis B, hepatitis C, even HIV infections patients are given. Diabetic neuropathies you can take. Here we are giving in AVN, and it can be very well used for anti-inflammatory thing, especially in conditions where there is a chronic inflammatory things like rheumatoid arthritis, ankylosing spondylitis. These are things where it is indicated. So friends, extracorporeal blood oxygenation, ozonization can be used for various conditions. It's an adjuvant therapy for the cancer patient also. In cancer patient, we basically give as an adjuvant therapy. The patients who are on chemo, who are on radio, they can take this as an immune booster, even for various type of infections, even for chronic inflammatory conditions like rheumatoid arthritis, ankylosing spondylitis, inflammatory bowel syndrome. In fact, for general wellness ke liye, you can take all these things. So if you are looking for EBOO, you can contact us on the below given number. Thank you so much.